Carbohydrates, insulin, water retention, and high blood pressure. How are they all connected? Well, they are all connected. So let's start at the beginning. So high carbohydrates, especially for an extended time in a sedentary body, is going to cause the overrelease of insulin in a prolonged state. That is not a good idea. It becomes a disease state. But what happens with insulin is high insulin always triggers a high aldosterone. And aldosterone is a fast-acting hormone that one of the things it does is it causes water retention. And it does that, but because when sodium is present, when aldosterone is present, there can be no sodium in your urine. Well, water always follows sodium. So if there is no sodium in your urine, sodium's not passing through, so water's not passing through. Sodium's getting reabsorbed, so water's getting reabsorbed, and we're just blowing up like the Michelin man. It's one reason why, if you constantly have lack of sleep or bad sleep, you're always puffy. Why when you're stressed, you can always be carrying a lot of water retention that doesn't need to be there. So with sodium, it can't be in your urine. I mean, you could sweat it out. You could go to the sauna and lose water weight that way, but you're not peeing it out. So we're retaining a lot of water when aldosterone is present. And if we're in a high insulin state, we're in a high aldosterone state. Okay. Now, if we're retaining a lot of water, we're not just retaining it under our skin, in our bodies, we're also retaining that water in our blood. And if we are retaining water in our blood, then our blood volume is greater. The amount of blood we have is greater. And if we have a greater amount of blood in volume, then our blood pressure is going to go up. But that's not even the end of it, because insulin is a growth factor. It is a very, very powerful growth factor. I mean, it tells a cell to speed up, it tells a cell to live, it tells a cell to grow. And what it will do with regards to blood pressure, a high insulin state, and this is one of the symptoms of insulin resistance, is, in fact, let me pull up a diagram. It will thicken of a blood vessel. It would thicken this inner lining, this endothelial lining. It will thicken it. Well, if you thicken this lining, you've just made the tube, right, narrower. So that's going to increase blood pressure. So if you've just made the blood vessel narrower and you've got a greater volume of blood, both factors will increase your blood pressure. And we all know how dangerous that can be. So this is the environment that we're talking about here can start off as insulin resistance, and insulin resistance, if you go back a couple of videos, can really get missed, because in regular blood work, a lot of the time the doctor doesn't ask for fasted insulin levels, so your glucose numbers are all good and you don't realize you've got elevated insulin levels. So often it's missed. I really stress for you to, when you do your blood work, really make sure that fasted insulin is in those lab reports. So insulin resistance is absolutely linked to high blood pressure, which is linked to a myriad of everything, right? I mean, I think it's the #1 biomarker of death by any cause or something like that. It starts with water retention. So when we talk about insulin resistance, it might get missed because our blood work might not identify it for us. And if we keep going with insulin resistance, then we're into pre-diabetes. Now we're into diabetes. Now we know about it. We could have turned that ship around a few steps ago had we have known. Other signs of insulin resistance. So insulin resistance is where insulin is not being recognized by the body. It's taking a lot of insulin to do its job, basically. So maybe insulin can still regulate your blood glucose, but it's taking a lot of it to do the job. The cells aren't really listening to insulin, so the pancreas releases more insulin and more insulin to try and get it to do its job. That's insulin resistance. These signs, please do your blood work. I mean, gosh. And it would be water retention would be a sign of insulin resistance. So would high blood pressure, guaranteed. So would belly fat. So would, and this one comes up a lot, dark patches of skin or skin tags. usually in folds, like they'll be under the neck or in the armpits, usually folds of the skin or where there's a little bit of moisture. Dark patches or skin tags are also a sign of insulin resistance. If that sounds like you, get your blood work done. Find a coach like me. We can turn that around.